Hello, friends. My name is Michelle Fondin, and I'm the author of Enlightened Medicine, Your Power to Get Well Now, an integrative approach to healing the 7 deadly lifestyle diseases. And welcome to my YouTube channel. Thank you so much for joining me. Today, we're going to focus on what if your doctor doesn't believe you when you tell him or her your symptoms? What do you do? That topic came to me today, early this morning. As most of you know, I just moved to Redondo Beach, California, and I joined a networking meetup this morning, and I was able to speak. It was very interesting. They had a smaller group, and one of their speakers wasn't there, so I was able to speak. And I really talked about a lot of the things that I talk about in my first book, The Wheel of Healing with Ayurveda, an easy guide to a healthy lifestyle, and also in my chakra healing book, when I speak about my journey with thyroid cancer and then after what happened with the thyroid cancer. So I talk about that, and one of the things that I mentioned that I had totally forgotten about, but was really the reason why I got into doing what I am doing now with you guys in this video forum, but also the reason why I'm writing all of these books on health and wellness. And the one main reason that I got into alternative medicine was that when I was going through my process with thyroid cancer and the symptoms that I was experiencing after I had my thyroid removed, the doctors that I was dealing with at the time didn't believe me. They didn't believe I was having those symptoms. And I went from doctor to doctor, from endocrinologist to endocrinologist, and even to specialists, and nobody believed me. They were saying, like, it's all in your head, your blood levels are fine, you shouldn't be experiencing these symptoms. And I knew that my symptoms were real and they were actual, they were happening, and they were making me sick. And the one thing was my age. I was really young. I was 28 years old at the time, and then moving into the time where I was trying to figure out what was happening, I was 29 and 30, but still relatively young to experiencing a lot of the symptoms that I was actually experiencing. Many of those symptoms were also symptoms that mimicked hypothyroidism. So if you know anything about the thyroid, it regulates your metabolism, it regulates your heartbeat, it regulates your female-male hormones, it regulates a lot of things. And a hypo state, or hypothyroidism, it means that your thyroid levels are low so that you're experiencing a hypometabolic state. So meaning like everything else is slow. Your digestion is slow, you're slow moving, you feel sluggish and tired and fatigued. There's a concept in hypothyroidism where you have a concept of brain fog, where you can't think clearly. So I was experiencing all of those symptoms, and not to mention that I also had a whole host of mental symptoms as well that kind of occurred at the exact same time. So I was having the physical symptoms and the mental symptoms, like anxiety, panic attacks, but also depression, that were happening like in conjunction with one another. And these all happened as soon as I had my thyroid removed, whereas prior to that, I wasn't experiencing any of those symptoms at all. So it's interesting that even given the fact that I had just had both sides of my thyroid removed in 2 separate surgeries, that I was going through these treatments, and that I was on artificial thyroid hormone at the time, that no doctors were believing me when I was telling them these symptoms. Like, I was having things like my hair was falling out, my hair was turning gray instantaneously, and I was 28 years old, and I didn't have any of those things happening before. I was feeling really sluggish, and I was having brain fog, and I was experiencing a lot of depression, and what I called them blues, because I didn't like to use the word depression. And like, I had none of that prior to the thyroid issues, to the thyroid being removed and everything. So I am here to tell you, I'm living proof that because I pursued and because I believed in myself and the symptoms I was having, and because I kept searching for answers, and I searched in many doctors' offices, and I didn't end up having the answers that I needed within the walls of those doctors' offices. It just didn't happen for me. I went to maybe 3 or 4 endocrinologists. I went to some general practitioners. I even saw a psychiatrist at one point because the doctors kept telling me that it was all in my head. And so when someone tells you you're crazy continually, you begin to believe them, even though in the back of my mind, I knew that wasn't the issue. And it wasn't until I found integrative medical specialist. His name is Dr. Leonard Wisniewski. He is now retired. He lives in Colorado. And he was the only person that believed in me. He was the only person that believed my symptoms. He was the only person that saw things from a bigger picture. And that is the reason why I wrote the book, The Wheel of Healing with Ayurveda. And that is the reason why I wrote this book, Enlightened Medicine, Your Power to Get Well Now. It's not about you disbelieving in Western medicine. And in this book, I tell you time and again, and actually in every single one of my books that are on integrative medicine or alternative medicine, I tell you time and again, it's foolish for you to disbelieve in Western medicine. Take it with a grain of salt. Western medicine is excellent when it comes to acute symptoms, when it comes to serious injuries, serious surgeries, stage 4 cancer, many autoimmune diseases, genetic diseases, plastic surgery, things that need to happen in order for you to live a healthy life. Children with cleft palate or hair lip, what they call they're born with a severed lip where they can't nurse properly. So for things like that, obviously, Western medicine is a miracle for many people who may not be able to live lives that they need to live healthfully without Western medicine. So don't take this as a slam on Western medicine as a whole. Take it as you need to be educated about your choices as a person in the healthcare system that we have today, that you need to be assertive in your rights and your will, and that you need to ask informed questions, and that you need to find the right provider for you. And if that right provider is an integrative health specialist, it is even better, because integrative health specialists have even more choices to give to you for your own health. This reminds me of an OBGYN who became, after leaving obstetrics, became a gynecologist who deals with pelvic pain. And in women, apparently, I didn't know this until I spoke with her, but having pelvic pain due to gynecological reasons. So for example, having something like endometriosis, in which the uterus produces too much uterine lining or irregular uterine lining, and women have extreme period pain because of that menstrual pain, or just pain and discomfort because of the buildup of this uterine lining. Or women that have ovarian cysts, and that creates a lot of abdominal discomfort. So I was speaking with her about pain management, because pain management is one of the things that she does most in her practice. And she shared with me that for pain management, for people dealing with chronic pain, there is no good solution in Western medicine. You can keep throwing pills at people. First of all, pain pills only have a limited span of working. That's the first step. The second step is many pain medications, opioids, are extremely addictive. So you're trading in one problem for another problem, meaning okay, now you might not have the pelvic pain when you're taking these pills, but now you have an addiction and you're experiencing a whole host of symptoms that are related to taking opioid pain medications. And she said, in the end, even strong doses of those opioid pain medications do not work for the pelvic pain. So she said, as physicians who are smart in this business, we have to learn how to resort to other methods. So she learned to deal with her patients with acupuncture. And acupuncture is a great way that she has found that has helped alleviate those symptoms of pain, using aromatherapy treatment or using herbal medicine. So an integrative medical specialist can use other methods, and they don't just have to deal with prescription medication. And they don't just have to deal with surgery. They don't have to just deal with invasive therapies. So because they have more tools at their disposal, then they don't have to deal with just one tool or two tools. They can deal with a lot more and help you get on track to feeling better. Now, I'm not talking about, of course, if you suffer from hypochondria or being a hypochondriac. I certainly know people like that. I know people in my own personal life who, if they stub their toe, they think they're dying of foot cancer. You know, that just happens. It happens where some people get just way too paranoid about certain symptoms. Symptoms are there so that you can listen to your body and heed your body's wisdom and advice, and you can dig deeper into what's going on. But at other times, you can imagine symptoms into being. And I know this has happened to you. So if you've ever read an article about a rare brain disease, all of a sudden that week, you're maybe thinking in the back of your head, like, what if I have this brain disease? And so like if you have a headache, you're thinking, oh no, it's this rare brain disease I read about earlier in the week. And that happens to medical students, that happens to psych students when they start reading about all these psychological disorders. Pretty soon, as they're reading more and more and more and more case studies, they get these psychosomatic symptoms where they think like, oh no, I have this. And that's pretty normal among the medical community when you're studying to be a doctor, studying to be a psychotherapist or a psychiatrist. You know, a lot of people self-diagnose wrongly because all of a sudden they believe that they have these diseases. And where it gets clinical is when someone has hypochondria and they're constantly thinking that there's something wrong with them. I'm not talking about that. I'm talking about the fact that if you have symptoms that are enduring, that keep going on, and that you're expressing this to your healthcare provider and they don't believe you time and again, or they're sending you to specialists and the specialists are running tests and those tests are coming up normal, then you need to perhaps look further into an integrative medical specialist, alternative medicine, doing alternative methods. So in this book, I really talk about the buildup of Western medicine in the first third of this book. In the second 2/3 of the book, I really talk about what are the alternative practices that you can do to help you get on track in healing and helping yourself when you're experiencing symptoms, and helping yourself when you have an autoimmune disease, when you're helping yourself when you have chronic disease. And so I do talk about those alternative healing modalities, but I also outline practitioners who can help you, that are integrative medical specialists that can help you. So one form of alternative medical specialists that can help you are naturopaths. You can go onto Google and just search naturopaths in my area, and you can find a naturopath in your area. Typically, these are out-of-pocket expenses. But for me, when I found Dr. Leonard Wisniewski, my integrative health specialist, when I found him, I paid out of pocket. I had to, because he didn't take insurance. And a lot of integrative medical professionals will not take insurance because they spend a lot of time with you. So because they spend anywhere between 45 minutes to an hour and a half with you, they can't get reimbursed for their time and their expertise by the medical insurances. It just doesn't work that way, because they might pay them $25, $30, $35 for the visit, when in reality, if you're working an 8-hour day, you cannot make $35 an hour and have a practice that remains open. It just doesn't work that way. So in the beginning, I was paying out of pocket because I had to see my integrative healthcare specialist a few times. Like, I had to see him a handful of times before things were regulated and things were better. But after that, I was healthy enough that I didn't have to see him but once every 6 months, and then eventually once a year. So the great thing about experiencing an integrative health specialist is that they will get you healthy so that you don't need to go see a doctor. And for me, that was my number one goal, is that after going through what I went through with all the medical testing and what I had to go through by seeing all these doctors who didn't believe me anyway, and I'm still paying the bills, you still have co-pays and extra expenses that they don't cover, and prescriptions that they prescribe to you that aren't covered at 100%. So there's a lot of expenses involved when you're trying to dig deeper and get to the bottom of the problem, that if you would just go to an integrative healthcare specialist who really delves deeply into what's going on and looks at more the holistic picture. And that's what I do with my Ayurvedic consultations as well. So I'm an Ayurvedic lifestyle counselor, and so what I do is I help get to the bottom of what's going on with your health as well. So when you pay a little bit more upfront to have a specialist that specializes in integrative health look at you, yes, you're paying more upfront, but in the long run, you're probably spending a lot less money because you know how much medical testing costs. You know how much blood tests cost. You know how much prescription pills can cost. It's crazy the amount of money that they charge now for prescription medications. So that's my advice to you. If you are turned down by physicians who are just telling you that it's all in your head, I would say if you're experiencing these symptoms and they're not going away and they haven't gone away and they're just reoccurring, your body's trying to tell you something. And just keep pursuing it. Keep believing in yourself. Oh my gosh. I will tell you, I had this very low point at which I was beaten down because, like, honestly, nobody was believing me. And I'm like, this is not normal. It's not normal for a 28-year-old to have no energy. It's not normal for me to be happy one day and to be completely depressed the next day. Like, that is not normal. And I had this prescription of Xanax that some psychiatrist had given to me, and I knew it wasn't working, and I knew that wasn't the solution. And I was like sitting on my front porch, and I was crying, and I was upset. And I said, I don't know what to do because no one will believe me. Like, not even my husband at the time believed me. Nobody believed me. And I was like, I knew inside of myself that I had the capability to heal, that my body had the capability to heal. I just didn't know what the solution was. And I just remember like being so upset that I took that bottle of Xanax and like I found a dumpster nearby. We were living in townhomes at the time. And I like walked all the way over to the dumpster and I opened the dumpster and I threw the prescription in there and I said, now's the time. Like, I need to find someone who believes in me. I need to find someone who's going to believe me that I'm having these symptoms. And I did. And I was able to find Dr. Wisniewski, and I was able to pursue treatment not only with him, but he had a nurse practitioner that helped me with guided meditation. And I had a massage therapist through his office who was helping me like relax and create those endorphins and those good chemicals. I had a complete change in my prescription plan, which went from a synthetic thyroid hormone to a natural thyroid hormone with pig thyroid, which was interestingly enough because I had been vegan for a while during that whole treatment process because I was really trying everything. So here I was, a vegan / vegetarian taking pig thyroid, which I still take to this day. So I thought that was a little bit humorous that a pig has to die in order for me to be healthy. Thank you, pigs. But I just changed my mindset and I said, if no one will believe in me, I have to believe in myself. And my strong sense of faith was another thing that carried me through. Honestly, God opened up doors for me and God opened up possibilities for me. And without the help of God and my angels, there was no way I could have gotten through that because it was so disheartening. It was such a trial that I went through in order to come out on the other side well without like just having a total nervous breakdown, because when you're feeling so sick and you're feeling so many symptoms and you're not getting to the answers, you're not getting to the bottom line of what's going on, and that on top of it, the medical community doesn't believe in you, it's just like, it's easy to go out of your mind. It's easy to go, is it all me? Is it all in my head? Keep pushing forward. And if you have questions, please feel free to leave it in the comments section below. My email address is michellefondinauthor@gmail.com. Now, I don't answer very specific questions to your condition because in order to do that, I would need a whole health history. And I do Ayurvedic lifestyle consultations. I can do that. But I really try to stay away of answering very, very specific questions about your health issues because I'm not a physician. I'm not a doctor. I don't have a medical degree, so I am not authorized to do that. But on the second thing is that Ayurvedic practitioners like to see the entire picture. And so if you ask me a singular question based on the symptoms you're having, and I don't see the whole picture because I don't know your health history and what's going on with your health and wellness and your lifestyle and what you're eating and how you're sleeping and what your household looks like as far as your family relationships, it's really hard for me to answer that one specific question based on that one bit of information that you're giving me. So don't think that I'm withholding information or I'm being difficult. It's not that. It's that a holistic healer needs to see the actual whole picture in order to make an informed decision to give you advice on that. So that's why. It's not that I don't love you. So thank you so much for joining me. Please subscribe to my channel below. Share this video with friends, family, and your dog. And thank you for pledging your support on Patreon. If you don't know what Patreon is, it's a way of putting a tip in the hat. So if you like these videos, if you like what I do, you can support me in many ways. You can buy a book or two or share with a friend, and you can pledge your support on Patreon. YouTube has really strict rules about being compensated through AdSense words or through Google Ads on YouTube. And so most people that work on YouTube don't get paid very well unless if you're in the millions of subscribers. So Patreon is a great way, again, to put the tip in the hat to say thank you, I got a lot out of this video, or I'm getting a lot out of your videos, and I support you as an artist and a creator. So it's www.patreon.com/Michelle S. Fondin, and I will see you in the next video.